Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I had a question posed to us about the Aetna Medicare Advantage plan. So the other day, transit workers, retired transit workers 100, local 100 workers had a seminar that was held by Aetna down at the Marriott in Brooklyn. And they were asking them questions, and some information came out that, oh, well, this is an enhanced plan and it's different than all the other plans and it's custom made especially for you. The same BS that Aetna was giving us and the unions. And they said, well, how is it custom? And they're like, oh, well, you have perks and, you have rides and all these other things. They're like, no, we just want healthcare. We don't need all that garbage. And this is what we've been trying to say, is that when you sell off your health insurance for a perk that you may or may not use, you're selling off your health insurance for a perk that has little to no value to you. They may help some people, but they won't help everybody. You don't need silver sneakers. Most communities have senior gyms or have senior passes or senior community centers that you don't pay, or you pay very minimal for your gym. Some seniors can't use a gym. They have disabilities. Other seniors don't need Access-a-Ride. You have Access-a-Ride in your community that's free. So we don't understand what the purpose is. And then even the Access-a-Ride, many people have complaints about it, that it takes for hours to get there, that they cancel their appointments, they stand you up or take hours to come back and pick you up. But one of the things that they kept saying was, well, how is this plan custom? And I'm like, it's not custom. The only thing that changes is the perks, but the plan is still a Medicare Advantage plan. It is not traditional Medicare. 97% of doctors in America accept Medicare traditional. There is no network. So as long as the doctor accepts it, then they have to accept your secondary. And you can see 97% of the doctors in America. What they were trying to sell to the unions, and because they were young and inexperienced with what the hell they were being told, is that, oh, well, we'll see 88% of the doctors that are in the GHI plan. Those doctors are in the Aetna network. And I'm going, that's nothing. That doesn't mean that doctors in America are in the Aetna plan. That's not even telling you how many doctors we'll only tell you that the doctors that retirees are currently seeing in GHI. But see, GHI isn't the network. Medicare is. And since Medicare doesn't have a network and 97% of doctors in America accept it, that means you can see just about anybody. But in the Aetna Medicare Advantage plan, you can't say that. And if Aetna was really being honest, they would say how many doctors in America accept Medicare. And when we say how many doctors, we mean how many belly buttons, how many individual people, because one of the things insurance companies do is they lie about their network. So if you are a doctor and you have an office in Queens and you also have an office in Brooklyn, they count that as 2 belly buttons. That's not 2 doctors. That's 1 doctor. So that is deceiving. If you have a doctor with more than 1 specialty with 2 offices, let's say you're a gynecologist and a gastroenterologist, and you have 2 offices, to Aetna, that could be 4 doctors. It's really just 1. So when you're asking how many providers you have, make sure you specify how many belly buttons do you have. You want to know individual doctors. So this is how they plump up when we say we did a video on how big is your network, because we weren't kidding. They like to lie about their network or the size of their network. But it was very telling. Aetna was asked this very question and by the union members, and they wanted to know exactly what made this plan so custom. Other than it being a PPO, they said, which we understand is, what makes it more special than any other plan or any other Medicare Advantage plan? The answer given by an Aetna representative, who was a sales rep for the company, told them that really the only thing that made this plan custom is that they added 2 hospitals in there, Hospital for Special Surgery and Memorial Sloan Kettering. That's it. Nothing else. So I want you to hear her words, so you're not hearing it just from me.
About the Medicare Advantage. For the city of New York, as we've included Memorial Sloan Kettering in hospitals for special surgery, that is what's custom about this link.
That is what's custom about this. Yep, that's it. So we were like, well, that's really, 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 really interesting. So you added 2 hospitals, nothing else, and then other than the perks. So that's it. So this isn't a plan that you want to be in. If you do, it's your choice. You should be able to get in and out of it. But in most cases, you can't. And when you can, if you do, you're not going to be able to get back into traditional Medicare with the same ease that you were getting into it. Many people won't be able to get back into traditional Medicare, especially your young disabled people that live in other states, not New York, Maine, Massachusetts, or Connecticut. So understand something. They're lying to you when they say that the plan is enhanced. It's really not an enhancement. I'm not quite sure what they're talking about as being enhanced. You're basically selling off your ability to see any doctor in America. You're saddling yourself with prior authorizations, delays and denials of care. And as we've seen this week, that there were several articles that came out from established publication and research, as well as the Office of the Inspector General, Health and Human Services, that Aetna, among other companies, overcharged the federal government, which is draining the federal Medicare trust, and wrongly delaying and denying care for people. And that means you, the people. So it's not a custom plan. It's just being sold as special and custom made especially for you, and it's enhanced. But it's still a pure diminishment of your benefit. Everything that you don't have to deal with in Medicare traditional, you are saddled with in this plan. And then they give you some bells and perks and whistles to make you feel special and think you got something that you didn't get in your other plan. But what you did is you gave up pure direct access to any doctor in America. And they're being oversubsidized by the federal government so that they don't have to administer healthcare to you. They overpay them, and these companies are wrongly using that money, wrongly upcoding, overcharging the federal government, your tax dollars, to do that. Another tidbit on Medicare Advantage.